About 60 to 70% of people with diabetes have mild to severe forms of neuropathy. And nearly 54,000 diabetics with neuropathy have amputations each year, out of which 75% are preventable if treated well and on time. We have numerous examples of famous personalities who suffered from this severe medical condition. Eric Clapton, the greatest English rock guitarist who won 18 Grammy Awards, sold 100 million records of his music worldwide, and one of the most iconic guitarists of the rock era, suffered from diabetic peripheral neuropathy, due to which he struggled to play the instrument on which he made his name. Similarly, nearly 70% of people with fibromyalgia remain undiagnosed, and it affects around 2 to 4% of the US population, or as many as 6 to 12 million people. For example, Morgan Freeman, having more than 65 international global awards, along with Golden Globe Lifetime Achievement Award, suffered from fibromyalgia that caused him excruciating nerve pain, which made him to struggle with his professional career as well as on personal levels. The trend continues as many other famous people have brought to light their struggles with severe depression and anxiety, such as Dwayne Johnson, Michael Phelps, J.K. Rowling, Robin Williams, Abraham Lincoln. The WHO estimates that more than 300 million people worldwide suffer from depression and classifies it as a leading cause of disability worldwide and a major contributor to the overall global burden of disease. But let's find out what these diseases actually are. Diabetic neuropathy is a severe damage caused by diabetes. Over the time, high blood glucose and fat levels, such as triglycerides in the blood from diabetes, damage one's nerves. There are majorly 4 types of neuropathy: peripheral, focal, autonomic, and proximal neuropathy. Common symptoms of neuropathy include numbness, tingling, and body-wide pain, whereas fibromyalgia is a condition that causes pain all over the body, sleep problems, fatigue, often emotional and mental distress. The cause of fibromyalgia is not known, but it can be effectively treated and managed. The most common symptoms of fibromyalgia are pain and stiffness all over the body, problems with thinking, memory, and concentration, and headaches, including migraines. Similarly, depression or major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression symptoms generally include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, trouble sleeping or sleeping too much. But all these conditions can be easily managed if treated well, and we have a solution for it: duloxetine. The National Institute for Health and Care Excellence, European Federation of Neurological Societies, American Academy of Neurology recommends duloxetine as first-line treatment for painful diabetic neuropathy. A multinational randomized double-blind parallel group study on 1,074 patients shows a 24-hour mean reduction in pain score with duloxetine compared to pregabalin, which proves that duloxetine is more effective in diabetic peripheral neuropathic pain than pregabalin. Similarly, duloxetine also provides significant improvement in pain relief, enhances quality of life, reductions in fibromyalgia, impact questionnaire, and brief pain inventory scores in patients with fibromyalgia and diabetic neuropathy. A randomized, double-blind, placebo-controlled Phase 3 trial of duloxetine in fibromyalgia and neuropathic patients shows major mean change and reductions in 24-hour average pain severity score. Multiple studies indicate that duloxetine reduces pain symptoms through the blockade of reuptake of serotonin and norepinephrine. Studies show that duloxetine inhibits 5-HT and norepinephrine uptake in the hypothalamic synaptosomes with a preference for 5-HT. An item-based analysis on the efficacy of duloxetine in depression, published in Journal of Neuropsychopharmacology in 2020, shows a significant superiority of duloxetine over placebo for depressed mood, guilt, suicidality, agitation, and psychic anxiety, which proves duloxetine is significantly effective in patients with depression and psychic anxiety. Duloxetine shows better safety profile compared to pregabalin in weight gain, dizziness, somnolence, and edema. Hence, duloxetine is recommended as first-line treatment for painful diabetic neuropathy, shows significant improvement in pain relief, and enhances quality of life in patients with fibromyalgia, neuropathy, depression, and anxiety with better safety profile. This video was brought to you by Pharmevo, proud manufacturers of Duzalta.